Welcome back and thank you for staying with us. South Africa's new reality in the age of coronavirus. Well, Health Minister Dr. Zweli Mkhize announced 8 new coronavirus cases in the country. This brings the total number of confirmed cases to 24. Well, let's take a look at the effects on business, families, as well as that on schools. To unpack this story further, I'm joined now by strategy consultant, futurist and global speaker at Tomorrow Today, Graeme Codrington. A very good evening to you, Graeme, and thank you so much for joining us.
Hi, good evening.
Now, let's just start with a book that you wrote, I believe, 15 years ago, predicting some sort of global pandemic. What exactly was the description that was in that book? I'm curious to know.
Now, our organization, Tomorrow Today, are strategists and futurists, and that doesn't mean we predict the future, but we have been tracking, we've been in business for 20 years, and we've been trying to understand disruptive forces. So we've looked at everything from technology to changes in demographics. And one of the flags that we've had, something that we thought people should always be thinking about, is what happens if one of the diseases that goes around every winter typically turns into a global pandemic. And of course, a number of years ago there was SARS, and then there was H1N1, and those threatened a little bit Ebola as well. But this one we saw about a month or two ago. Was the big one. And the real reason, and I think maybe some people are wondering, why is this one more significant than the others? And mainly it's that 14 days that it takes to show in your body. Normal flu takes 1 day.
And you know.
So you're feeling sick, you know, and then you stop greeting and connecting with other people. This one, you've got it in your body for 14 days. Think of what you can do, who you meet.
In 14 days, you could fly across the world in 14 days.
And that's what people have done. We maybe shouldn't make jokes about this one too quickly, but this is a rich person's disease, because it's all the people who've gone on holiday, who've traveled internationally on business, and they're moving all around the world. You can't stop it. And I think that's the big message now. We can't stop this. It is coming to South Africa soon. It's here already in
It's actually here already. I mean, 24 people already that have been confirmed to have the virus. I know there was one person who had tested positive, but then later on there was found to be negative. Yes. So, I mean, those that have traveled abroad and have brought it into the country could now essentially spread it because of that incubation period.
Well, look, I'm not a medical doctor, so we must listen to the medical experts. We must listen to Dr. Mkhize and so on. I'm a scenario planner, and the scenario that I see at the moment is that there are already thousands of people who have this disease in South Africa, and that they're incubating now and they're spreading it. And this is what's happened in Iran and in Italy, and it's now happening in America, is that we go from 24 cases to next week Wednesday a few hundred, to next week Friday
exponential increases,
1,000.
So what then, Graeme, can we do then as a nation to try and reduce the amount of spread of the virus? We've seen countries that have gone into lockdowns with schools closed, governments closed, a lot of corporates closing down. We've had a lot of sports events being cancelled, as Benjamin mentioned earlier on Sport On. Concerts being cancelled, you know, a lot of different meetings. So as South Africa, seeing that we have already 24 cases confirmed, and as you've mentioned, it's possible that there are more people who have the virus, but it's still incubating in their bodies. What then should we be doing?
Well, there's good news and bad news here. The good news is that this virus is actually remarkably easy for us to fight. 90% of people who get it, it's not going to influence them too much. In fact, half the people who get it aren't even going to know they have it. They're going to have mild temperatures, maybe feel a little bit miserable. It's not even going to feel as bad as normal flu. The 10% is the problem. And that's easy to say if you're part of the 90%.
Yes, of course.
You know, if you're young, if you're healthy. I'm one of the 10%. I have asthma. And if you are a smoker, if you have anything wrong with your heart or your lungs, if you're old, over the age of 75, or if you're very, very young, or if you have some other immune issues like HIV.
Pregnant women also get immune compromised during that time of their life.
Exactly, of course. I've got a colleague who's going through chemo at the moment for cancer, hugely at risk. Those are the people we're really concerned about. And what we need to do now is we need to realize the British government yesterday said we can't contain this anymore. We can't stop the spread, but we must slow it down. So that's what we're trying to do now. We mustn't panic we might get it. We probably will. What we need to do is, if you're in a vulnerable position, then you need to be even more careful. And the good news is that actually the advice we've been given works. The reason for that is this coronavirus is the biggest coronavirus we've ever dealt with. You can't see it with your eyes, it's still small, but it doesn't stay in the air. So if you cough it out, it falls fairly quickly onto surfaces. It then stays on those surfaces, depending on the temperature, for a number of minutes, sometimes some hours, if it's in a cold space and the conditions are right. And that's why we have to wash our hands. Because nobody's licking surfaces or anything. Not. You're touching only with your hands. So if it's on your hands, you don't have it yet. It's not in your system.
You can wash it off. You
can wash it off. So as long as you're not touching your face, and I'm not even going to touch my face to demonstrate.
Please don't.
Exactly.
You're already at risk.
Exactly. So you don't touch your face, and you wash your hands, as they say, 20 seconds, sing the happy birthday song twice. Yes. That's the easy advice. We've heard all of this advice, and some people are saying, that seems too simple. This sounds like a crazy disease. Is it that simple? The answer actually is yes. But of course, the other thing we can do is make sure we keep some social distance.
Yes.
I know at the Newzroom studios, we're normally this distance apart, but this is a good distance because we can't infect each other at this distance, even talking to each other, even actually if I cough a little bit. So we've got to do this with everybody, and that means we've got big decisions to make about church on Sunday.
Yes.
We've got big decisions to make. The sports people are doing.
With Easter coming especially, a lot of churches have, you know...
That Easter, the minister was
trips,
talking about that today, and I think it's very, very important, especially the vulnerable, to think about that carefully. My business is in the meetings industry, and I have lost work now, and this is the bad news, is that we have to do this.
Are people willing to have meetings then via Skype or
and that's the shift we're making. So we've got a COVID rapid response team that's helping our clients to work out how do you work from home. I think all the PwC offices in Europe today, I think it was PwC, they sent everybody home just to test for one day. To say, let's see what happens if everybody works from home. And even small businesses can try that next week. Tell everybody on Tuesday we're going to test our systems, work from home, see if it's possible. If there's an IT problem or a systems problem, we can fix that. I think families that have vulnerable people in their families, they need to be having the conversations now. How do we keep our grandparents? How do we keep our sister who's got a lung infection at the moment? How do we just... You don't have to lock them in their room and not speak to them.
Of course, just extra precautions that we have to actually apply. Well, thank you so much, Graeme, for joining me this evening. That was Graeme Codrington. What a tongue twister. Futurist, unlearner, and a global speaker at Tomorrow Today. Just letting us know that there are precautions that we can take as a nation, as businesses, and as individuals in order to reduce or slow down the spread of coronavirus. Moving along, former President Jacob Zuma's bid to appeal against